Welcome to the Deep Dive, the place where we analyze complex systems, zero in on the most vital data, and give you the knowledge you need to be quickly well-informed. Today, we're going deep. We're looking inside the body's most critical engine, the cardiovascular system. And we're going to be guided by the concepts laid out in the Cambridge International AS-level sport and physical education syllabus. Our mission is, well, it's pretty essential. We need to master the relationship between heart rate, stroke volume, and cardiac output. And we're going to use some hard data to show exactly how training changes everything.
Yeah, it's a great place to start. So to get everyone on the same page, let's lay a quick foundation. We're really dealing with three core variables here.
The building blocks for everything else.
Exactly. First up, we have heart rate, or HR. Simple, it's just how many times the heart beats per minute, your BPM.
Got it.
Second, we've got stroke volume, or SV. That's the actual amount of blood the heart pushes out with one single beat. We measure that in milliliters or ml.
So frequency and then volume per beat.
Precisely. And that brings us to the big one, cardiac output, or CO. It combines the first two to tell us the total volume of blood the heart pumps in a full minute, and that's in liters per minute.
Which gives us the equation we'll keep coming back to.
The one and only. Cardiac output equals heart rate multiplied by stroke volume. CO equals HR times SV. That's the bedrock.
Okay, so that equation is key. And just to give everyone a baseline, an average untrained person at rest, their cardiac output is somewhere between 4.8 and 6.4 liters per minute.
That's right. Just sitting still, your body needs about 5 or 6 liters of blood circulated every single minute.
Okay, so let's unpack that. Let's talk about efficiency, especially at rest. We always hear about elite athletes, marathoners with these crazy low resting heart rates in the 40s, sometimes even the high 30s.
Right, yeah.
I mean, if my heart rate was 35, I'd be calling for an ambulance. So what's going on there? Is it just that they're more efficient? Is that what bradycardia is for an athlete?
That is a perfect question. And yes, it all comes down to a powerful training adaptation. That incredibly low heart rate is only possible because their heart is so much more efficient.
So how does the math work out?
Well, if we look at the data, you see this amazing paradox. So the untrained person, they get their 5 liters per minute of cardiac output with, say, a heart rate of 75 beats per minute.
Right.
And to do that, their stroke volume is maybe 66 milliliters per beat. It's relatively small.
Okay.
Now, the trained athlete, they need the exact same 5 liters per minute at rest, but their heart rate might be just 45 BPM.
Wow, that's a huge difference.
It is, and it's only possible because their stroke volume is massive in comparison, maybe 111 milliliters for every single beat.
So the core insight is, it's not just about heart rate, it's the work done per beat. The athlete's heart is doing more work with each contraction, so it doesn't have to contract as often.
Exactly. It gets more rest time between beats. That's called diastole, which means it can fill up with more blood. It's just a beautifully efficient system.
But that efficiency at rest is really just setting the stage for what happens when things ramp up, right, during actual exercise.
That's where the real difference shows up. Absolutely.
So let's go there. Let's talk about maximal effort. An untrained person sprinting, going all out. Their max cardiac output might peak around 20, maybe 30 liters per minute, which is a big jump.
It is a big jump, but now look at the trained athlete. Because of all those long-term changes, they can push their max cardiac output way higher. We're talking 30 to 40 liters per minute.
So wait, that's a difference of up to 20 liters a minute. I'm just trying to picture that. That's like...
It's enormous. It's like moving 2 huge 5-gallon buckets of water every minute more than the untrained person. It is a game-changing physical advantage.
So what makes that happen? Is it just a higher max heart rate?
That's the crucial thing. It's not. Maximal heart rate is pretty much fixed by age for everyone. The real difference, the key performance variable, is all about maximal stroke volume.
Okay, so can you give us the numbers on that?
Of course. At max effort, the untrained person's stroke volume might go up to 100 or 120 milliliters per beat.
Okay, a decent increase.
It is. With the trained athlete, their heart can push out an incredible 160 to 200 milliliters with every single beat. That massive volume per pump is the single reason their cardiac output is so superior.
So we know what a huge stroke volume, but how does that physically happen? I mean, in the moment when the intensity suddenly spikes, how does the heart manage that huge surge of blood?
Right, that's the acute mechanism. And for that, we have to look at a fundamental mechanical principle called Starling's law of the heart.
Starling's law.
Or the Frank-Starling mechanism, yeah.
Yeah.
It basically states that the force of the heart's contraction is directly proportional to how much its muscle fibers are stretched right before it contracts.
So it's like a rubber band.
Exactly like a rubber band. That's the perfect analogy. The more you stretch it back.
The more powerfully it snaps forward.
Precisely. So during exercise, you get this massive increase in what we call venous return. More blood is flowing back to the heart, and faster. That extra volume of blood flows into the ventricles and causes a much greater stretch of the heart muscle, the myocardium.
So it's pulling the rubber band back further.
It's pulling way back. And because of Starling's law, that bigger stretch leads to a much more forceful contraction. A more forceful contraction ejects more blood. Boom! Your stroke volume instantly goes up. It's an automatic, built-in feedback loop.
And that ties back perfectly to the athlete. Their heart is structurally bigger from training, so it can handle more blood to begin with.
Yeah.
It can take advantage of that stretch mechanism way more effectively.
That's it. They could reach those peak stretch points that let them hit that incredible 160 to 200 milliliter stroke volume we were talking about. It's not just about making the heart faster. It's about making it mechanically capable of handling these huge volumes.
Okay, that covers the mechanics, the hardware, so to speak. But what about the software, the regulation? If the heart is an orchestra, who's the conductor?
The conductor sits in the brain, in the medulla oblongata, to be specific.
Yeah.
We call it the cardiac control center.
And it's sending out instructions.
Constantly. It monitors everything and sends instructions to the heart's own pacemaker, the sinoatrial node, or SAN. And it does this mainly through the autonomic nervous system.
The ANS, which I always think of as having two sides, right? The accelerator and the brake.
That's the perfect way to describe it. You have the sympathetic nervous system, that's your accelerator. When you need to ramp up, it tells the SAN to speed up the heart rate.
And the brake.
That's the parasympathetic nervous system. When you're cooling down or at rest, it's in charge, telling the SAN to slow everything down. They're in this constant, elegant tug of war to match your heart rate perfectly to what your body needs.
But for the control center to make those calls, it needs good information. It needs feedback from the body. That comes from receptors, right?
Three main types, yes. They're the body's sensors.
Let's start with the chemical ones, the chemoreceptors. What are they sniffing out?
They're basically sampling the blood. They sit in the major arteries, like the carotid, and they are incredibly sensitive to chemical changes, especially carbon dioxide.
So when you start exercising,
Your muscles produce more CO2. The chemoreceptors pick that up instantly and send a signal to the control center that says, hey, metabolic rate is up, we need more oxygen. And that's when the sympathetic accelerator kicks in.
okay, so that's chemicals. What about pressure? That feels important.
Vitally important. Those are the baroreceptors. They're also in the big arteries, and they act like pressure gauges. If your blood pressure drops, they signal the control center to speed up the heart to bring it back up.
And if it gets too high?
They tell the parasympathetic system to hit the brakes and slow things down. It's all about maintaining that safe, stable pressure.
And the last one, you mentioned there are three. This is the one that's almost predictive, right?
Yeah, these are the mechanoreceptors. They're in your muscles, your joints, your tendons, and they detect movement itself.
So they're almost ahead of the game.
They are. The second you start to move, even just standing up from a chair, these receptors send a lightning-fast signal. Movement is happening. Get ready. This lets your heart rate start increasing almost instantly, even before the chemical changes have really registered.
That's an incredible network. So let's zoom back out.
Hmm.
If someone puts in the work for months, for years, how do all these systems change permanently?
The big long-term change is structural. It goes back to what we were saying about stroke volume. The heart actually gets bigger and stronger. It's a process called cardiac hypertrophy.
So the muscle itself grows.
It does. And specifically, the chambers of the heart, especially the left ventricle, increase in size. A bigger chamber means it can hold more blood during that filling phase, diastole.
Which lets it use Starling's law to its full potential.
Exactly. A bigger chamber allows for a bigger stretch, which allows for a more powerful contraction. It all connects.
So really, long-term training gives you three key outcomes. First, that structural change gives you a permanently higher maximal stroke volume. Second, that allows for that super efficient low resting heart rate we talked about, bradycardia. And putting those two together gives you a much, much higher maximal cardiac output. The whole system gets an upgrade.
A complete system overhaul. That's a good way to put it.
We should also touch on what happens after the race is over, the recovery period.
Oh, absolutely. Recovery is kind of the final signature of a well-trained system. The body has to switch from that sympathetic accelerator back to the parasympathetic brake. The heart rate has to come down smoothly.
And the heart needs to get back to that efficient filling state.
It does. And because the trained athlete system is just so much more efficient, all of those variables, HR, SV, COCO, they all return to their resting state much, much faster than in an untrained person. It's another tangible, measurable benefit.
This has been a really high-resolution look into the body's engine room. We started with that key equation, CO equals HR times SV. We saw that an athlete's real advantage comes from a massively superior maximal stroke volume.
Which is enabled by the mechanical principle of Starling's law.
The rubber band.
The rubber band, yeah.
Yeah.
And then we mapped out that incredible control room with the accelerator and the brake being guided by all those chemical, pressure, and movement sensors. It's just so precise. And if you want a final thought to chew on, think about how fast that system is. The mechanoreceptors, the movement sensors, are so quick that your nervous system starts to increase your heart rate before you even consciously realize you're starting an intense movement.
A preemptive response.
It's a preemptive response that keeps your blood pressure stable and prevents you from, say, getting dizzy when you jump up.
Yeah.
It shows how the body's regulation is often a step ahead of our own conscious intent. It's just an incredibly complex and immediate system.
Mastering these cardiac variables is the pulse of your AS physiology exam. More data sets are at revisedirect.com. Join us next time for another deep dive.